Hi students, here today's lecture you will learn about drug tolerance and drug dependence. So this two term is very common. So because every drug is having their adverse effects and their therapeutic effect. Okay, so if someone is taking any drug or medicine to cure some disease or disorder, then after certain time, if he is not discontinuing the drug, using that drug again and again, or you can say self-medicated, self-taking, if some disease he is feeling like the previous one, then he is going to take again the same disease, then it may cause tolerance. Okay, because your body means biological phenomena is that everything which is coming from outside to inside in our body, so it is having its own phenomena, own mechanism, body's mechanism, which can tolerate anything after a long exposure to a certain drug or substance or anything. So it is the biological phenomena, natural phenomena of our body to take something toleratively. Okay, and if someone is produce tolerative effect towards certain substance, particularly here I am talking about drug, then it will cause dependency. So it will cause again two types of dependency. One is psychological dependency, another one is physical dependency. Okay, so let us move through the lecture on board. Okay, so drug tolerance definition is, in simple, you can say that this is because of reducing the action of a drug which the patient is taking. That particular drug is reducing the action to that patient. Okay, why it is happening? Because of repeated use. Okay, so if some drug is showing its effectiveness that is reduced by taking the drug, that means it may be tolerated. Okay, then because of repeated use, first cause is that one. Then increased dosage may re-amplify the drug's effects. So if that person, that patient is taking the drug in a larger amount, then it may give the therapeutic effect. Okay, then what will happen? And it may accelerate tolerance. Again, after certain time, it will cause tolerance. Okay, then further decreasing the drug's efficacy. So efficacy is nothing but the activity of the drug or effectiveness of the drug, which is showing for its cure, for the disease cure. Okay, so if some person is taking the same drug for longer period of time in some amount like 500 mg of paracetamol or any other benzodiazepines like psychological or drugs or antidepressant drugs, okay, or anti-anxiety drugs. So these are the drugs which are affecting the CNS. So our CNS is the main monitor of our body, which is controlling our body functions. Okay, and it is having so many hormones and neurotransmitters which can be altered through using the drugs. Okay, so if some person is using continuously some drug, means one single drug for a long period of time, it will cause tolerance, and that particular amount means 500 mg cannot be enough for him or her to use again. So it will need to take more larger dose than 500, then again 650 like that. Okay, so mostly psychological drugs, means for psychological disorders, the drugs which are used, those drugs are mostly tolerated by the patients. Okay, so another definition you can see here: requirement of higher dose of a drug to produce a response. So same thing here also. Okay, so in a single word you can tell tolerance means requirement of higher dose of a drug to produce a response. To produce a response means not negative response, positive response. Particularly whenever we are going to take some drug, definitely our aim is to improve our health. Okay, so if it is giving positive response, then that is called as therapeutic index. If it is not giving positive response, then it is not called as therapeutic index. Then it will again come to the tolerance, or it can be called as dependence. Means you are depending on the drug and you are feeling some happiness or some highness, okay, or some activeness. Though that reason you are taking the drug, so that is nothing but the disadvantage of the taking drug, that is dependence. Okay, so later I'll tell about the dependence later. Okay, so first I have to complete the drug tolerance. So next, another one is loss of therapeutic efficacy because of higher dose. So after certain period of time, there is no therapeutic index or no therapeutic effect is producing by the drug, like sulfonylureas. So this is a drug which is used for type 2 diabetic patients who the patients are not able to produce the insulin, proper insulin in their body. So for them, they are using sulfonylureas as a drug, okay, to make that lack of insulin to produce a proper working of the insulin they are taking. So after certain time, which is having tolerance, okay. So after certain time, it is not having any effect, okay. So it is another term you can tell, refractoriness, means there is no proper effect, okay, means there is opposite action towards the drug, okay, or lack of action towards the drug, or drug is not giving any action. Lack of action of the drug is nothing but refractoriness, okay. So tolerance can also be called as refractoriness, okay. Then tolerance is a widely occurring biological phenomenon. Already I told you that because our body is having that much power to tolerate some drugs, okay, genetically or biologically or whatever it is, okay, our body is having that power. So that for that reason, certain drug for repeated use can be produced tolerance, okay. Then tolerance may be of two types. Number one is natural, number two is acquired, okay. Natural in the sense, if our body producing the tolerance towards the body naturally by genetical alteration in genetic code, then it is called as natural tolerance. So some species or individual is genetically or inherently, okay, means from family to family, okay, varying. So inherently or genetically less sensitive to a certain drug, okay, to a drug or to the drug, okay. So to particular drug, some individual or some species may have the tolerating power, means there is no response towards that drug for certain species or certain drug. Why certain species means towards animals, you can say rabbit is having more tolerating power in atropine, okay, than human, okay. The example is rabbit are tolerant to atropine, okay. Then second example is some individuals in any population hyper responders to certain drugs. Again, someone not responding towards the drug, that is also called as tolerance, and some are hyper responders, means giving more effect than whatever we require, okay. So that is called as hyper responder to certain drugs. Example are beta adrenergic blockers. So this is mainly for hypertension, beta adrenergic blockers, or to alcohol. So certain persons who may give the hyper responder to such drugs like beta adrenergic blockers and to alcohol, okay. So beta adrenergic blocker, propranolol is the beta blocker on type of that one, okay. So for heart disease, okay. Then acquired means it is producing by ourselves, means we are intentionally taking the drug and producing tolerance towards the drug. Why we are taking that drug? Because we may feel happiness by taking that drug, or some person is feeling unhealthy for certain period of time, and due to that silly reason also, if he or she is taking the drug, then it will cause acquired tolerance, okay. After certain time, the drug will not work. Particularly if you can see, you can observe that some persons who are not visiting to professional doctors, who are already passed out doctors, instead of them they are going to quack, and they are visiting the doctor, and doctor is without knowing proper reason, without proper diagnosis, they are giving some antibiotics. Okay, then antibiotics will cause tolerance towards that particular individual. So after certain time, what will happen, if he is getting certain dangerous health consequences, then if he is going to take again that same antibiotic, okay, like amoxicillin, okay, so norfloxacillin, these type of antibiotics, so he will be resistant to that drug, means tolerant to that drug, tolerance towards that drug. So that is not good. Okay, so that is called as acquired, okay, intentionally or by others prescription, who is not properly professional doctor. Okay, so occurs due to repeated use of a drug, because you are now knew that okay, this drug is giving, that quack is giving to me, so I can use again this one. So repeatedly you are using that drug, so it will cause what? First it will cause initially responsiveness, okay, but later it is tolerated, and CNS depressants, particular drug, are more tolerated. So the drugs which are taken for CNS depressant effect, so those drugs can be more tolerated than other drugs. Okay, then significantly tolerance not developed to atropine. So for human being, atropine mostly cannot be tolerated, and digital is cocaine, sodium nitroprusside, so these type of drugs mostly not tolerant to the person or to the human being. Okay, then another point, tolerance not developed equally for all actions of a drug, means certain drug give some particular action, and other drug will give some other action, so tolerance will differ that action. Okay, so tolerant not developed equally for all action of a drug, means the drug cannot be equally give the action for the other person also. Okay, because of the tolerance. Okay, the same dose cannot give the same action, okay, for a different two person. Suppose someone is taking paracetamol 500 and someone is taking 650. So that person who is taking 650 mg of paracetamol, so if he is taking 500 mg, so it cannot be responsiveness for him. So already he is tolerated towards the larger or higher dose. So that's why varying. Okay, so that is nothing but tolerance not developed equally for all action of a drug. Then therapeutic index may increase or decrease with prolonged use. So obviously, if someone is taking for longer period of time some drug, so definitely it will reduce the therapeutic index. So what is the therapeutic index? Suppose certain drug initially doctor is prescribing for 10 mg, okay, and its highest dose is 50 mg. So if some person is taking 50 mg in first initial phase, then what will happen? Then whatever the previous doses are there, it will not effective for him. Okay, so that will cause tolerance. But if he is taking 10 mg for a certain period of time, again after some disorder, if he is going to take again 20 mg like that, so it will effective. But up to the main dose, if he is reaching, means the last dose is a 40 mg or 50 mg, so it will, after that one, it will be tolerated fully and there is no response. Okay, so after long and prolonged use, decrease the therapeutic index, means minimum range to the optimum range of a drug is nothing but therapeutic index, means the range in which is the response for the effectiveness of to cure a disease, that is called the range through which the disease can be cured, that is called therapeutic index, means lower to that optimum. Okay, that is called therapeutic index. Okay, so example are, number one, sedative action of chlorpromazine. So chlorpromazine having two types of action, one is sedative action, another one is antipsychotic action. So for two purposes it can be used, chlorpromazine. So if someone is taking chlorpromazine for sedative action, so it is tolerated, but for antipsychotic action it is not tolerated. Okay, for sedative action, if longer period of time someone is taking, so sedative action may not be helpful by using this drug, but for antipsychotic action it may be helpful. Okay, that is here telling sedative action of chlorpromazine is not that much tolerated, but not for antipsychotic action. Okay, means chlorpromazine can be tolerated in case of sedative action, but cannot be tolerated in case of antipsychotic action. Okay, then second one, tolerance to sedative action of phenobarbital. So this is another drug, okay, which is having a tolerance towards the sedative action, means calming effect. Okay, if someone is having anxiety, so this drug may also useful for sedation. Okay, lack of sleep, if someone is having, so this drug is helpful particularly for sedation action. So tolerance to sedative action of phenobarbital, but not as much to its anti-epileptic actions. But for not anti-epileptic action, it is tolerated that much not tolerated. Okay, then for analgesic and euphoric action of morphine, tolerance can be occurred. Okay, so morphine in case of analgesic and euphoric action could be happen, tolerance effect, but not as much to its constipating and meiotic action, because analgesics like morphine is giving as side effect as constipation and meiotic action, means pinpoint of pupil, so it cannot be tolerated, means it will giving that effect. Okay, means repeatedly it will give, but it can be tolerated towards analgesia and euphoric action. Okay, then cross tolerance. What is cross tolerance? Developed between pharmacologically related, means the drugs which are related to pharmacologically, okay, means structurally or pharmacological action is same or less, more or less same. Okay, so those are nothing but pharmacologically related drugs, means the drugs which may have the same action or near to the action, so those are called as pharmacologically related drugs. Example, alcoholics. Okay, alcoholics are relatively tolerant to barbiturates. Okay, so alcoholics, these are the pharmacological related drug, okay, with barbiturates. So this and these are tolerated. Okay, and general anesthesia, because these drugs are more or less pharmacologically same, so tolerance will occur. Okay, then this is called as cross tolerance. Okay, and partial cross tolerance between morphine and barbiturates, and but completely between morphine and pethidine. So there is no need to explanation here. Okay, then drug dependence. What is drug dependence? If certain person is using drug for not any reason, proper reason, so it may developing the dependency. Okay, so the drugs which can alter the mood, means for the reason of changing mood, okay, or feelings, if someone is taking a drug, so it will cause drug dependency. Okay, are liable to repetitive use to derive euphoria, because euphoria is the feeling of excessive happiness, extreme happiness. So someone who is dependent on the drug, so they are repeatedly using the drug for this reason to change the mood or feelings, okay, and getting some happiness. Okay, the repeated use. So we withdrawal from real world social behavior. So this will cause, means if someone is drug dependent, then it will cause social behavior changes, and he will be away from the reality or real feeling or real world. Okay, so he will always happy individually. Okay, then drug dependence is a condition. This is a condition of using drugs for personal satisfaction. So whoever depending on the drug will use the drug for their personal satisfaction, not for therapeutic use. Okay, then already I mentioned here that not therapeutic use. So other than therapeutic use, he is using the drug. Okay, so knowing the risks to health, but that person is knowing, yes, it may cause the physical or mental change after long period of time, but he is feeling euphoria and he is changing his mood and feelings, that's why he is using. So irrespective of knowing the risk to the health. Okay, Then dependency is of two types: psychological dependence and physical dependence. So what will happen to psychological dependence? A person believes that optimal state of well-being can be achieved by the use of drug. So his thought is that, the person's thought is that psychologically, that if I am taking more drug, then only I will be happy. Then only my health will be okay. So his belief already believed he believed on certain medicine, that if I am taking the drug, achieved it's through drugs action only, means health will be good through drug use only. Okay, so he will start to like the drug, and he will think that it should be compulsory for me. Okay, so certain persons who are using certain drugs for repeatedly, if he is getting certain disease also, like you can say acidity is the most common example. If someone is getting acidity, so he is going to take medicine again and again repeatedly, so this may cause dependency. Okay, means his entire histamine release system will be disrupted. Okay, so he is psychologically dependent on that proton pump inhibitors, means acidity anti-acidity drugs. Okay, so and then his like to that substance, means to that drug, is towards compulsory, and desire to craving, means initially he is just having desire, then after a long time he is craving, means yes, I need like that. Okay, means intense desire he will develop. Then all pattern of self medication means then he will start, or she will start self medication. Okay, then reinforcement. Okay, so it will cause him, he cannot stop to use the drug, so in reinforcement will occur, that if he is going to stop the drug, so again it is enforcing to use psychologically, that no, I am not getting feeling good, so again I have to take. So reinforcement of that particular substance will occur, like opioids and cocaine. Okay, the most appropriate example is opioids like drugs and cocaine. Okay, so already I discussed about opioids and cocaine in other video. Okay, you can go through that one, like analgesia. The video is called analgesia or analgesics drug. Okay, so you can go through that one. Then physical dependency. So physical dependency means altered physiological state. Okay, so whenever someone is habituated towards using the drug, so his physiological state will be changed, because his mental tolerance, means his CNS tolerance is increased, and by that way his physiological function also altered. So physical dependency will develop. Okay, because of repeated administration of the drug. Okay, of the drug. So why physiological function is altered or state is altered? Because of the repeated administration of the drug. So now the physical dependent person will necessitates continued presence of drug. So this is very important point. So now he or she will think that no, without this drug my physiology will destroy, so I have to depend on this one. So he is necessitates that drug to use as a compulsion. Okay, for physical equilibrium. So he or she is thinking that without this one my physiology will be disrupted or destroyed. Okay, so for the reason of physical equilibrium he will think like that. Then if this continue, then what will happen? It will cause side effect. Okay, so he cannot discontinue it. Okay, then neuroadaptation. So by that way, whoever adopted to the physiological dependence of the drug, so neuroadaptation will happen. Neuroadaptation means whatever the neurotransmitters in the brain or nerves in the brain or in periphery, so those functions, neurotransmissions or neurotransmitters release, its effect all are changed, altered by the drug, because the drugs mostly like CNS depressants or antipsychotic drugs like benzodiazepines or barbiturates, so or morphines or codeines or opioids. So these drugs can change or alter the neurotransmitters release. So he is already dependent or she is already dependent, means every time now he cannot withdrawal that drug. If withdrawal is happened, then he will think lack of physiological equilibrium. Okay, so neuroadaptation occurred by that way. His compulsion towards drug is happened. Okay, then altered brain functions will occur. Neuroadaptation means altered brain function, means without that substance now brain cannot work properly. Okay, examples are again opioids, barbiturates. Okay, so and then other drugs like depressants, alcohol. Okay, for the it is used as depressant. Okay, benzodiazepines, then stimulants as cocaine and amphetamine. So these are the drugs which may cause dependency. Okay, and tolerance and dependence, all this about the drugs. Okay, so now up to here, now what is drug tolerance and what is drug dependence? In short, you can tell that if someone is repeatedly using certain drug or medicine for a longer period of time, it will cause tolerance to that person. And if certain person is taking the drug for his desire to get euphoria or feeling or mood change, then it is called as dependency to a particular drug or substance. So thank you for watching this video. Hope so that you understood the lecture. If you understood, then please comment below the comment section and like, share and subscribe. Be with us for next other videos. Thank you so much.